Hello and welcome to our weekly live show with Pros and Babes, where we help you engineer your success, leadership, and life harmony like a mother. Becoming a mom or a working mom can be really hard. It changes your identity, your relationship with your spouse, your body, your finances, your career trajectory, everything. And we here believe that you should never be alone with a crushing overwhelm of trying to figure out how to navigate all of that. So that's why we bring you the best experts. And this week I have Dr. Max Dekterov, chiropractor, who's here to talk with us about all the changes that your body experiences in terms of your spine and your bone structure when you become a mother, and to give us some tips on ergonomics for both for mom and dad, so that you can, maintain a healthy body and be able to be active as you become a parent. So welcome, Max.
Thank you, Kenya. I'm glad to be here. It's a little bit lunchtime, but it's wonderful to be here. Yes.
Thank you so much. So tell us first why you are passionate about the topic of mothers and the changes to their muscle structure and their bone structure during pregnancy. Why is it a topic that you're excited to discuss with us?
Of course. Biggest thing I saw with starting to treat actual families is that the mother actually takes on the biggest brunt of physical changes. Whenever I notice that they tell me, "Oh, Max, I got pregnant," and then we know that's going to be a process where things change, even my adjustments start to change, and that really got me interested in actually understanding fully how I can help these mothers go through transition of pregnancy and after the fact.
Yeah, absolutely. Well, so I have two boys, mine are 2 and 4, and definitely so much changes. In fact, I'm almost like it's 2 years after the birth of my second, and only now am I really starting to feel like my body is maybe truly mine again. Not 100%. I'm still nursing my youngest boy, so it's not fully mine, but it is a huge change. So tell us, what happens to the spine during pregnancy and after pregnancy, and what do moms need to know and do about these changes so they can bounce back to feeling good as quickly as possible?
Absolutely. The biggest thing I would say, don't rush. The ironic thing is actually not rushing what the body is naturally meant to do. As we know, elastin is the biggest one for our body, like female bodies, to increase and levels up to allow the pelvis to open up for the birth. That in itself has a big change in the body because every joint in your spine is very similar to the other. Regardless of the size, there's certain amounts of, say there's 3 different types of joints, but the majority are the same ones that are in your spine, in your, say, knuckles. So those actually are affected by elastin, and they allow for better motion. Some others, when they become pregnant, they notice they, I pop a little bit. That's the beginning. But then the posture starts changing. As we know, the belly starts getting bigger, the chest starts getting bigger. And naturally, we have curve of our spine where we allow, pretty much it allows the gravity to be able to absorb, like a slinky. The thing is, though, we're pretty much getting pulled 2 ways. We're getting the chest to pull forward, the belly to pull forward, and that tilts the pelvis and tilts the rib cage. We still have to look straight ahead, so then our head tilts up. So that just pretty much we start collapsing and the curves start getting much bigger.
Mm.
Yeah, so this is where you want to really look at, if my body's changing so much, what can I do to maintain that posture? And it is said that after perhaps first trimester, it is important to actually maintain your strength. A lot of moms think that, well, it's gonna be 9 months. I'm just gonna get through it, and then I'll do everything after. It's technically not how it works. There's a lot of things that happen during a pregnancy that may prevent you from being able to, say, do heavy exercise. Say your lactation gets limited if you go for a run. That's totally reasonable. It's finding the ability, finding the amount of exercise you can do to especially maintain the core strength that will keep your head above your shoulders, keep the thoracic spine somewhat in line, and your pelvis is the biggest one. Keep your pelvis somewhat relatively stable. Yeah.
Okay, good. Well, those are some good physiology basics. So so let's say we've gotten through pregnancy and like the initial period, we've maintained our core strength. Somebody like you can obviously work with patients to enable a positive transition, right? And adjustments that can smooth things out for people. So let's jump into the ergonomics while taking care of baby. So we start hearing of all of these interesting terms. I used to run these groups in person, but you know that those movements that mom do, like scooping up baby or nursing, right? You can spend so many hours nursing or just in these weird positions. There's these I don't know if it was called baby elbow or whatever, but some people
Mm.
have actually
Mhm.
specific pains related to moving with their baby. The ergonomics are affected, right? There's baby wearing, there's bathing, there's putting them in the crib, all of that. So what can you do to prevent spinal pain, both for mom and dad in this season of life?
Absolutely. You want to really approach a baby, I want to say it, but it's as though it's a part of a ergonomic assessment. Let's put it that way. It's a very wriggly and excited object that you have to handle. So if you say, for example, gardening, that flower, like flower pot, if it's say at your knee level, how would you lift it? It's in a sense a very delicate object. You know, if you tip it over, it's gonna drop on you. So it's the same with a baby. You need to pretty much still remember the points of always using your hips before using your low back, always bending your knees before bending your back, always making sure that when you're looking at something, like well, when you're looking at your baby, you pretty much follow your eye movement first, and then you say reach or you look at the baby. The problem is it's almost like you can have a text neck. You know, as I say, when you're texting or you're looking down, it's a similar concept of a baby. You're so interested at the being at seeing what the baby is doing, what they want, that you almost get enthralled in what they're doing. This pretty much sets the point of how you're saying about pretty much it's almost like tennis elbow. We have it on the lateral side, and it's that prolonged holding. We either can hold the baby this way or kind of on your forearm, correct? And realistically, that in itself is a factor where it can prolong, pretty much prolonged holding can irritate those muscles, which weren't really used to you holding a from 10 pounds to even 30-pound object that is also wriggling. So this point is that we need to make sure that we are holding baby, but also ergonomically being able to be aware of our own body. And if we need to take a break, we put them, perhaps we sit down and then put them on ourselves. Like, have them sit on us or lay on our tummy just to offload our upper body, which in general, in our day to day life outside of babies, isn't utilized as much, especially if we're say working on computer or when have you heard lunch break, a mom comes, is done, say lunch, and I'm gonna go for a walk. I'm gonna go do stairs. When is the last time have you heard a mom say or a dad, I'm going to do some bent over rows or or some say pull-ups? Those things are not needed, but you need to utilize your upper body in some capacity. So things like yoga. Yoga is very, very, very good at being able to offload the shoulders, offload the forearms, offload the wrists, which take a brunt of our day to day with babies because we I wish we could. I wish we could hold the baby with our feet. We can't. So we have to use everything on our upper body. The other part, pretty much, if you want to look at, so let's talk about the mother is done her maternity leave and she's going back to work. The time between, as you say, 2 years it takes to really transition from having a baby to almost being able to be in your own body. That in itself has a factor on the our ability to get back to that normal, and our factors that we do, or pretty much what we do with our body in say we're sitting, we're at the kitchen table, we're in your car, grocery shopping, really does have a factor on how quickly we can get our body to be more symmetrical, if you could put it that way. What I've seen with moms that I treat is that when they come in, they have had experience or been given suggestions on, say, for example, nursing, but they haven't really ever been given their direction on, say, proper ergonomics post birth. So post maternity leave. And that changes because, in a sense, when you are, say, for example, before you're pregnant, you're a bit taller. So when that mom comes back to work, it actually is advisable to get an ergonomic assessment if your company provides that, or we look as your monitor, feel like it's a little bit too high. And you have to mitigate it where it's in the middle. You don't want to bring it down fully because you actually want to consider yourself as being a bit pre-birth, so a bit more upright. So that may be giving you a cue that, oh, I am a bit slouched, my shoulders a bit rolled in. So give yourself that ability to go up. But at the same time, if you can, standing is always a viable option for us to. I'm actually standing right now. I only have a standing table. So the standing kind of revolution is where you're able to stand, you're able to use your work, you're able to pace, you're able to still sit. And I think that is where moms can really see the benefit of returning to work safely and effectively. And from that, again, if they built those healthy habits from when they were pregnant, the biggest thing is continuation of healthy habits. So if they were able to do yoga when they were pregnant, it helps. It facilitates them to do yoga that much more once they are having, like, the baby is growing and they're moving with the baby. Um, it can be said it can be said that tummy time for moms is actually not a bad thing. That upward dog, it's seriously a blessing in disguise sometimes when we're so forward forward positioned. Our everything is in front of us. Almost nothing isn't behind. Almost nothing we have to reach for. It's very convenient. Our world is designed on how we stand or sit. But for the body, that ability to be moving in rotational or extension is what is needed, which is a little tougher for when you're pregnant. I have to emphasize that those rotation extension isn't something that is that easy for moms because it just you are very much forward dominant. So there it's more what's called static holds. So pretty much you've heard of exercises for your core, and some people do, say, crunches or sit-ups. You would never want to do crunches. Never do crunches. But isometric holds, which are pretty much you contracting your abdominal muscles without movement. So you may have heard of planks or side planks. These are very, very good and very effective ways to actually, during and post, develop and maintain your core activation, where it helps through the whole cycle. That's it.
Okay. Okay. So thank you for those examples. Let's say that somebody decides to work with a chiropractor as their care plan, maybe before pregnancy, during pregnancy, postpartum. What does the typical care plan look like? I mean, I know every person is different, obviously, and you adjust them differently. But what kind of adjustments? How do you work with your patients in order to increase their mobility, reduce the pain? What are some of the most typical things that you do with moms to help them ease the transition through the different developments their bodies undergo?
Mm-hmm. And the biggest thing, so whenever the mom comes in and she's like, I'm pregnant. I got pregnant 2 weeks ago. Perfect. That's our start of where we go and where we pretty much start moving. The biggest thing I see is that, again, the pelvis is able to relax. Elastin just gets funneled in the body and is everything go. The one thing is that, again, our bodies never have been designed for sitting. A lot of moms, they really can take off, maternity leave when they're pregnant, they work almost to the T of when they're gonna have the birth, and then they have mat leave. So if a mom is sitting, the pelvis is not designed for that. So just imagining whatever happens with us as sitting, our pretty much our low back is not able to sustain that posture of, well, it's not a posture, our sitting ability. So we get what's called creep, and our actual spine starts bending forward. It almost flexes while we're sitting. That puts strain on the little joints on the back, and that's what
Making
happens.
me so guilty here, I should say.
I know.
Like I'm on my chair here, I'm like, adjust my posture, swim longer. But anyway, I'm like, okay, I'm sitting here now.
Oh, and there's some good technologies and some finicky technologies that are helping us. Even if we have to sit a little bit, they're helping us. So with elastin, it's almost like you are adding a little spice to that mix of low back pain. And that's where we start seeing that the body needs not more treatment, just more specific treatment. So say, for example, we treat the pelvis a lot more diligently, as in we focus on it every visit. We check what is called leg lengths. We see which way it's pretty much, if one goes shorter or longer, and we see actually the SI joints, which are your pelvic joints, if they're tilted back and forth, and how the sacrum sits. And from that, we actually able to see and decide which way we're going to be adjusting. And nice thing is for me, when elastin starts going, the adjustments realistically, um, they can be much more easy for me to achieve. And at the same time, the forces are still actually the same. It's just the impulse is a bit different. So if
So you
ever,
mentioned something. Sorry, I'll just
yeah,
jump in. You mentioned elastin. So can we define for our audience what that is? I assume it's a hormone, something that's coming in that's changing things.
yes, correct. And so elastin is our natural body's ability for, say, our tendons, our ligaments to be stretchable. And moms, luckily, have an increase when the baby is being developed, where it's able to be more, just a little bit more elastic. So it is a hormone and it affects those pretty much all our bones, all our spinal bones, all our pelvic bones, and between our joints are held by ligaments. So these are especially important for a pelvis because there's three bones, and the only way it keeps them all together is through these ligament tension bands. But you need to pretty much open the pelvis when you're having the baby. When it opens, it stretches, but naturally, those ligaments do not stretch. That's not a good thing. Hmm.
Okay. Okay. So if we were talking about the elastin and the adjustments and how a course of treatment works with you, so how often does somebody come for adjustments, and when does somebody actually decide that they would like to get chiropractic care as part of their health routine, essentially?
Mm-hmm. I think that's the biggest thing is to start. A lot of times people think, especially with pregnancy, it's a problem they may be having, say, diverticulitis or their abdomen starts being spread, things like that, where or pelvic floor rehab, which is after the case. You should never look at you having a problem and thereby I need treatment. It's approach to general chiropractic in, say, families or working individuals is that a preventative is always better, and a lot of times we are able to pretty much maintain the structure of the body itself, where the birth is a little easier, perhaps the process of them baby developing is a little easier. So it's, how can I put this, every, as we always say, every patient is different, but it's a span of time when they are pregnant with a varying degree of frequency. Is it weekly? Is it monthly? Is it bi-weekly? It very depends on the patient and their ergonomics. If they say, you can't even say if they're more active, they would need less treatment or more treatment. It is very, very specific to that individual patient. But I would say an assessment is always the first course of, first step.
Yeah, absolutely. Okay. So what the last topic we want to discuss today was how to keep moving while working from home, right? With or without a baby, most people will put their children in childcare or get some childcare support if they're going to be working. But sometimes with the pandemic, we find ourselves with kids and working at the same time. So how do you stay moving when you're juggling all of these things? Really, from your days are so full, and often we tend to renegade ourselves to the last person on the priority list, right? So what are some general activities that you recommend for parents? How should they start preparing mentally to make sure that they get the movement required to retain the motion, to retain their health, and be able to enjoy being a parent, a working parent?
Very much so. The biggest thing you want to focus on. So, in this may come across some parents' minds is that could you multitask a baby? What I mean by that is that are you able to physically, say the baby's crawling, are you able to utilize that time to give yourself some mobility? A lot of times, say for example, a yoga routine, somebody thinks it's, oh, it has to be an hour or hour or a bust. That's not the case. Even 10 minutes, 15 minutes routine is appropriate daily. The other part is when you're, say, doing that routine of a downward dog, the baby can be on the floor with you. You will notice that they start being very curious of what is my mom doing? Oh my goodness, she's with me. And we never really realize just how much, and we probably do as parents when we see that the closer we get to the baby's level, the more they respond to us. And realistically, that's where you can utilize the time to be able to do things concurrently. The biggest thing, if your child is in daycare, is being able to, say you're working from home, get up about every 20 minutes for a little circle around the house. The other part is to focus. If you have to sit, move in your chair, literally, not move the chair, but just wiggle side to side about again every 15 to 20 minutes. And the last one is if you're able to say, we hear this so much, this meeting after meeting after meeting. If you are doing a meeting, find a space in your home, a bookshelf, a probably not actually an island. Islands are a bit too short for a laptop and you have to still look at something. A bookshelf is perfect where you can place that, say, laptop you have or desktop, and you're able to still be able to stand while listening. A lot of times people think of it as like TV, oh, I'm just going to sit back and relax. You can use that time to literally stand, to do a, say, a tree, you bring a leg up, you balance, and just doing those things, you will see the difference of where you're able to utilize. You just find that time. Again, it's inappropriate for us in our modern culture to, in a meeting in person, stand up and walk around. It should be really a really key part of our actual day-to-day activity in the workplace. But here, absolutely, you can stand, you can move, you can do whatever you want with your body. Nobody's looking, realistically. Hmm.
Yeah. Okay. Wait. So as we wrap up the chat today, I'll ask you if there's anything else that you want our audience to know about chiropractic care for mom and dad as they grow their families. What I really got out of this conversation, it shouldn't come as a surprise, but I mean, movement is critical. We can't ignore that. And to me, it reminds me that I should probably look into a desk that allows me to stand up and go up and down. Really, I mean, I tried to get an ergonomic chair, foot support, an ergonomic keyboard, and get a lot of movement throughout the day. But we spend so much time in front of the computer today, right? And with pregnancy, well, there's so much stress on the body, so many changes, and it's a time to really reflect and prioritize a good posture, taking care of your body, making sure that movement is part of your routine, making sure that you have a good care team, whether that's a chiropractor team, a physio, your midwife, your doula, your yoga team. However, it's a critical time to really think about the care that you give your body, right, in this season of life, because our kids watch us and then they emulate what we do. So if they see us taking care of ourselves, it will I incentivize them taking good care of themselves in the future. So I'm hearing movement. I've had chiropractic care in the past too, actually around my pregnancy time. So it can be, it's provided me a lot of relief. Is there anything else that you would like parents to know about chiropractic care, about their spinal cord, about anything they should be doing to preserve their health and maintain their health?
Absolutely. It's a little bit about ergonomics, actually. So the biggest thing you want to do, it's almost, I always go back to gardening because I love it, but when somebody's picking, say, a flower bed, they're actually almost always on their knees, bent over, digging through it. The best thing you can do for your pelvis, best thing you can do for your low back is think about doing a lunge. Realistically, a lunge will preserve your back, preserve even like when you're older, like in your senior years, if you can lunge, it will save a lot of balance. So when you want to say pick up your baby, doing a lunge. When you are giving him a bath in the bathtub, do a lunge. Everything you can do a lunge, and that will help everything. Biggest thing again, as I've without any of our social media, I'm pretty big on Instagram, Dr. Max or dr.maxyeg. Post every day about mommy, daddy, and just general ergonomics. So please follow me there.
I like the simplicity of that advice. And then my next question was to where can people find you? So we'll repeat that and go in more detail. But I like the lunge as the one thing. We're bombarded by information these days, right? Even as I'm getting back into my fitness routine, I started swimming a lot these days and going for daily walks. But I'm thinking about what are the next exercises I want to do. And so I'll keep the lunge in mind besides the squat. So thank you for that. And again, please repeat, where can people find you? Website, social media, all of that, if they want to find out more about you.
Absolutely. So the clinic I'm at is South Center Chiropractic Clinic. It's in Edmonton, Alberta. And my social media for both Facebook and Instagram is Dr. Max and then YEG for Edmonton, YEG.
Okay, perfect.
Mm-hmm.
All right. Well, thank you so much for your time today. I will see you backstage.
Take care.